COVID-19 outbreaks at facilities in Brampton and Bolton.
We need to provide essential workers with the adequate support and protection that they need.
Toronto and Peel health units are temporarily shutting down some workplaces with 5 or more cases, but some say those measures should extend across other regions in the province.
If I have to do a pop-up again, I feel like I might have to sleep in my car.
The hunt for a jab has become a frustrating and confusing new reality for many, and that's why some are calling for doses to be redistributed to areas that need it most.
This is CBC Saturday News.
Good evening, I'm Marivel Tarouk. 2 Amazon facilities in Peel region are partially closed tonight after workers there tested positive for COVID-19. They're the first workplaces forced to close under the local health authority's new measures to shut down facilities with 5 or more cases of COVID. Loretta Redicop reports.
This Amazon plant in Brampton is now partially closed, as is another one in the town of Bolton. The first closures under extra powers taken by Peel's medical officer. But other non-Amazon workplaces could soon be added.
There are still 6 that are currently being reviewed that may or may not move to partial closure, and also 3 that when we did reach out to those employers, identified that they had actually already proactively closed to stop the spread. I think you can anticipate that there will be other closures once we've had a chance to review.
With Amazon, workers on certain shifts have to stay home for 10 days with pay. The company won't say how many people are affected, but it's an estimated 11% of the workforce at the 2 sites. Toronto is the only other region taking this action, going beyond the provincial requirement. Toronto Public Health says it's investigating approximately 10 workplaces. On Monday, it will notify employers about any action they need to take, and it will publish the names of workplaces required to close. Another part of protecting essential workers is vaccinations. This meatpacking plant is preparing for its first on-site clinics next week. Like Amazon, it's had multiple outbreaks.
This is a massive logistics plan, as I'm sure you can imagine, to be figuring out how to have this many people vaccinated and keeping the plant running at the exact same time.
Peel's medical officer of health says so far 3 large companies will be hosting vaccinations. All will be required to also hold a pop-up community clinic. Amazon is one of them.
This is a numbers game. And if you've got a workplace that employs 3,000 people, well, if you've got an infectious disease that spreads like wildfire in an enclosed setting, not only are the people within that setting at risk of becoming ill, but they're going to spread that forward to their families.
He says the other key thing needed to keep workers safe and home when they're sick is legislated paid sick days. On Thursday, the Premier promised to bring them in, but had no details. Today, his office would only say they'll have more in the coming days. Loretta Redicop, CBC News, Toronto.
Families, doctors, and politicians are reacting to these new orders tonight. Some say shutting down workplaces with 5 or more COVID cases needs to be implemented beyond the borders of Toronto and Peel. Talia Ricci has that story.
That it's a step in the right direction. However, it's far too late.
Radhika Gandhi wishes the new workplace rules were in effect before her father died from COVID-19. But even if they were,
he worked in Woodbridge. According to the new rules, Woodbridge would not be shutting down. And that is ridiculous. There are a lot of factory workers in Brampton who travel to neighboring regions to work there too.
York Region's latest data shows 20 active workplace outbreaks. But for now, the region's medical officer of health says it won't be following Toronto and Peel, adding the region has strong case and contact management for workplace outbreaks and an aggressive vaccination strategy.
We have long since pivoted to the ultimate solution, which is really immunizing these workplaces. And as of April 13th, we would have done approximately 17 or 18 of these workplaces already. Our strategy in York Region has also been, in general, to vaccinate people over the age of 35 in these hotspot areas.
Brampton's mayor is hopeful that Peel's move will help curb workplace spread.
I'm glad that Peel took this approach. They didn't wait for anyone else to set a provincial or national policy. And one of the reasons that we had to take this approach is the numbers are high. You know, it's a 22% positivity rate. The same old approach isn't working. And using the same hammer on the same nail for the last year is broken. And we need to be more strategic and more focused.
The province didn't say the measures would be implemented across Ontario, but did say the Ministry of Labour has launched a series of workplace safety inspections in sectors and regions hardest hit by COVID-19. Gandhi says she often thinks about her father's last words.
Minutes before he was put on the ventilator, he said, "I want to come home." And as I lay in his room, as I lay in the ICU suite while he was taking his last breath, the only thing I could think of was the fact that I did not get to fulfill that promise and bring him home.
Talia Ricci, CBC News, Toronto.
Residents in COVID-19 hotspots say they're frustrated by the lack of vaccines being supplied to pop-up clinics. They say the process of getting an appointment right now is disheartening. Jessica Ng has that story.
By 7 in the morning, hotspot residents say there were hundreds in line at a Scarborough vaccine pop-up clinic, but not nearly as many happy clients.
No one told us that you have to be in a specific postal code. And a lot of these people here doesn't know this.
I came here yesterday as well, but I could not get the appointment.
This postal code has maybe 40,000 people. Yes. So how come 1,000 vaccine is allocated here?
Kindergarten teacher Lorraine Lendor also waited.
I'm impressed with that the line is actually moving.
But just hours later,
I'm back to square one. And if I have to do a pop-up again, I feel like I might have to sleep in my car and just wait, because what I saw today, that should have never happened.
She says she was hopeful when she heard about the clinic at John McCrae Public School because it's within walking distance to her home.
I've been trying to get appointments, like I'm sure everybody in the city, calling clinics and so forth. And I had actually gotten one online for the 28th.
She says she was notified by text that it was canceled.
We should have had more than one in our area to help and accommodate everybody in the area. There is no way that this one clinic was going to do that. From what I saw, no way.
Today, what kind of medicine?
Moderna.
Moderna? Yeah. Okay.
A pop-up clinic at Downsview Arena also had long lineups. Both of these areas average higher case counts and positivity rates.
We're learning that these mobile vaccine programs may not even have the supply to vaccinate people. This really doesn't bode well if this is our only strategy to connect with hard-hit communities.
Scientists say huge amounts of vaccine supply need to be brought into hotspot communities as soon as possible.
If we go with a lot of our vaccines into those neighborhoods in Ontario who were most severely affected by COVID-19 and have a lot of essential workers and their families living there, then what we see is that the strategy that now just focuses on that benefits everybody in the province.
In a statement to CBC News, the Ministry of Health says it is dedicating 25% of future vaccine allocations to 13 public health regions that need it most. Jessica Ng, CBC News, Toronto.
Toronto has administered more than 1 million vaccine doses. In a press release, the city said as of yesterday morning, more than 300,000 people have booked COVID-19 vaccination appointments at a city-run clinic, and that a limited number of appointments are available for the next 2 weeks. The city is also launching a new advertising campaign at Yonge and Dundas. These ads will be appearing for 10 seconds as part of a 3-minute loop on the screens at the popular intersection. And it's meant to encourage people to get the vaccine whenever their turn comes. Ontario is logging 4,094 new daily cases of COVID-19 today and 24 more deaths. As of yesterday, there were 2,277 patients in hospital with the virus. And currently, there are more than 800 COVID patients in intensive care across Ontario. And that has a big impact on other parts of hospitals. Dr. Shadi Ashamala is a surgical oncologist and the head of general surgery at Sunnybrook Hospital in Toronto. He explains the knock-on effect of increased hospitalizations and what it means for Ontarians.
We have shifted into what we're calling a crisis standard of care. That means that the normal standard of care that Ontarians deserve and expect is no longer an option for many disease processes because of the impact of our COVID-19 patients on our system. If a woman feels a new breast lump in the shower tomorrow, and that becomes diagnosed as a breast cancer, we are not able to remove breast cancers with an appropriate amount of wait times as we've normally functioned. Everybody needs to know that there are patients out there who should be having their cancers removed that are sitting with their cancers in their body, waiting patiently to have them taken out. We need to know the gravity of what's happening.
And physiotherapy residents are speaking out after the Canadian Alliance of Physiotherapy Regulators cancelled all of its clinical exams for this year. The residents say they are qualified and the system needs to be updated.
We are needed. We are essential people. We are essential professions according to the COVID essential professions. And yet we're not given that type of respect that I just want to get on with my life. And I think this process has really held me back.
She also emphasizes that physiotherapists play an important role for those who are recovering in the ICUs and for people developing physical issues while working from home. The regulator says they plan to reschedule all registered candidates into smaller, virtual or in-person sessions set to begin by the fall. In a statement to CBC, the College of Physiotherapists of Ontario says they're working with the national regulator and that, quote, implementing a responsible and workable solution that both facilitates the entry to practice and protects the public interest is the #1 priority for the college. Ontario's Ministry of the Environment is monitoring for campsite resales after finding more than 50 cases of sites being resold for profit. The minister calling it unfair.
Ensure that all Ontarians have equal access to enjoy our parks and green spaces throughout the year. We will continue to monitor our park staff, social media, websites for resales. We will also be taking in complaints from the public.
The ministry says they will cancel any reservations if they are found to be reselling online, which comes with a cancellation fee. Campsites are in high demand during the pandemic. Those searching for sites are also encouraged to look into campsites at smaller provincial parks. Kim McDonald's here with our forecast. I mean, just a beautiful day in Toronto today, Kim, to get outside in a safe way and enjoy the nice day.
So nice, right? This was the day that Marivelle, I took my winter coats out of the closet and brought them downstairs.
Oh, okay, well, if you're doing it, then we're guaranteed. No more winter, no more snow.
I'm living on the edge here, but I'm pretty positive that that's it. That's it. Winter took a little swipe at us this week on Wednesday. It was little, hey, how you doing? I'm still here, but it's not going to stick around. We have some very warm temperatures on the way. This is where we're standing right now, 15 degrees. You know, Toronto's normal daytime high is 14. We hit 16.5 on this Saturday. Not so bad. A little bit of high cirrus up there, but for the most part, we enjoyed a pretty sunny day. But cloud cover's coming. We've got rain showers in the early morning hours, so most people will likely not be awake for those. It'll last into Sunday morning, and then we're going to see a little bit of a clearing. So 8 degrees to start the day. Windy, yes, so temperatures are going to feel a little bit cooler because those winds are 50, 60 kilometers per hour at times. Daytime highs around 12 degrees in Toronto, so just a little bit cooler than average.
All right, well, we'll see you in a bit for the long range. Thanks, Kim.
All right, you're welcome.
NDP leader Jagmeet Singh hosted a virtual town hall today, calling on a moratorium on Laurentian University's refinancing process.
The combination of having a space, an institution dedicated to higher learning, specifically one of the best programs around Indigenous learning, and one that was founded with the input of traditional knowledge keepers and elders, the quality of that experience and the indigenization of the institution, we could see it as a really special place, combining that as well as being a space for Francophonie and a space for the North, created something really special and really unique.
The school is currently looking for court approval to move to phase 2 of its restructuring plan after it declared insolvency in February. In its first phase, the university announced cuts to dozens of academic programs, faculty, staff, and non-unionized members. According to university officials, the target date for completion of the key components of its financial restructuring plan is this Friday. India's daily case count soars to highs never seen before. The country posts another pandemic record for new infections. We'll have the latest on that straight ahead. India's pandemic disaster is deepening, with infections and deaths setting records and hospitals on the brink of collapse. Freelance journalist Neha Punya reports.
India's healthcare services are stretched beyond breaking point. In the last few days, we've seen several Delhi hospitals run out of beds, essential drugs, and now even the one thing that most severe COVID-19 patients desperately need, oxygen. Delhi has now become the epicenter of the outbreak here in India, and it's a city that's home to 20 million residents, but there aren't enough beds for most people who need medical care now. And most experts say that many are dying not because they have COVID-19, but because they cannot get admitted to a hospital. At least a dozen hospitals have written to Prime Minister Modi's government complaining of dwindling supplies as well. And because of this shortage, many hospitals are no longer admitting patients who have COVID-19, which is why outside hospitals you can see people carrying portable oxygen cylinders, hoping they'll get admission before their supplies run out. The country's health minister, Dr. Harshvardhan, says a control room has been set up. The government is monitoring oxygen supply round the clock. The Indian Air Force is now transporting oxygen to different parts of the country. India's extensive railway network has also been pressed into service. There's talk of importing oxygen, with the government waiving off customs duty on such imports. But many are questioning why the government wasn't better prepared, and the outlook for India is grim. This current wave of infections is expected to peak sometime around mid-May, and many critics are warning that India's already stretched healthcare services will not be able to cope with these daily numbers if the surge continues in the way it has. Neha Punya for CBC News, Delhi.
That variant is also being watched closely by officials in this province. As of yesterday, the province had reported 36 cases of the B1617 variant. And it is, of course, the variant of interest first identified in India. All the cases were detected in the last few days and appear to be travel-related. Officials say 30 cases were identified through the province's airport and land border screening program and tested at the National Microbiology Lab in Winnipeg. Public Health Ontario found the other 6 through its own laboratory testing program. Experts believe the variant is behind India's recent surge in cases and hospitalizations. Canada banned incoming flights from India and Pakistan on Thursday for at least 30 days. The search for the Indonesian naval submarine that disappeared this week has ended. Officials say there's no hope any of the 53 crew members survived. Debris has been found indicating the vessel sank. Search teams located a bottle of grease for oiling the periscope and a prayer mat. The submarine was last seen Wednesday off Bali. What happened isn't known, but officials say electrical failure may have disabled the submarine's ability to resurface.
To the street, steeped in silence.
That's Toronto band Moscow Apartment behind a concert for climate justice taking place later today. More on that coming up. that's a little taste of The Weather Station, a band from Toronto and one of the bands that will be taking to the virtual stage tonight to help push for mass mobilization against climate change, along with other big band acts like the Bare Naked Ladies and Scott Helman. The concert is being organized with the help of an 18-year-old member of the band Moscow Apartment. She's also the organizer and co-founder of the Canadian chapter of Music Declares Emergency and Climate Change Canada.
The goal of Climate Live is to get people motivated and just get active on climate activism. I think what's really unique about it being a concert is that musicians have a really unique platform where people really connect to their music. And when you know you're a big fan of a musician and they say, hey, this is something that you should care about, people often listen.
The concert will be streamed online for free at 8 p.m. tonight. So we had the Weather Station band open for your weather hit. Kim, how perfect is that?
I love having an opening band in general, you know.
Yeah, we should always have one, shouldn't we?
I totally agree. And if we could have an audience too, Maribel, that would be perfect.
Someday.
One day. I'm wearing my Leaf and my Blue Jay blue. Yeah, it's one of those Toronto sports days. 31.1 degrees is the record high for Sunday. Can you imagine 31.1? That was back in 1990. We're not looking at that. We're looking at a daytime high of 12 degrees. Which in comparison to last Wednesday, it's downright balmy. So normal daytime highs around 14, that's where we should be. The rain showers come in through the overnight, but it starts to clear through the day on Sunday. Monday is looking good as well, but look at the difference with those northwesterly winds. Barrie is going to be 6 degrees, so we're lucky to be sitting at 12 in Toronto. Here's a look at the upper level pattern. And again, we have this brief cool down, and it's not even that chilly before things really start to heat up. And especially if you're in southwestern Ontario, that's where you're really going to feel not only spring-like, but dare I say, summer. Okay, so we've got those winds on Sunday. They start to ease on Monday. That's when the temperatures start to rise. Look at this once we get towards Wednesday. So Toronto, 15 on Tuesday, Wednesday, 17 degrees, but we've got showers in the forecast. So, you know, if you're putting some seed down, that kind of thing, there is rain on the way. We're not expecting anything to be particularly heavy though. But I just want to show you Windsor for a moment, because Windsor on Tuesday is looking at a daytime high of 25 degrees, a far cry from the snow and freezing temperatures we saw last week.
All right, love those warm temperatures. Thanks, Kim.
You're welcome.
And that's our show for you tonight. Thank you for watching. Just before we go, though, the cherry blossoms are nearing peak bloom in Toronto's High Park, and the 24/7 Bloom Cam is live. You can enjoy these views from the safety of your home by checking out the City of Toronto website. Take care and stay safe as always, everyone. Good night.